The following is an original production of HCC TV, Howard Community College Television.
Joining me is the Director of the Medical Laboratory Technician Program, Nancy Calder, and the Director of the Physical Therapist Assistant Program, Ken Crivelli. Welcome.
Thank you.
Thank you.
Thank you so much for taking the time to be here today. And both of you have exciting programs, new programs to the college, and I know our listening audience are going to be thrilled to hear about them. So Nancy, how about if we start off with you? Can you tell us what a medical laboratory technician does?
An MLT will do laboratory testing. They will look for diagnoses to disease, but we also monitor wellness. And these tests that they do, they can do it on large instruments that take up a whole room, or they can use instruments that just fit in the palm of your hand. They not only run these instruments, but they have to troubleshoot it, they fix them. We are also known as microscopists. A microscopist will use a microscope. There are hundreds of things you can see underneath a microscope, and an MLT is responsible for identifying each and every item so that the doctor is given that heads up. Your patient has this issue or that issue.
That's fascinating.
It's fun.
And Ken, what about a physical therapy assistant?
Physical therapist assistants essentially perform functions similar to a physical therapist. So we perform treatments including modalities such as ultrasound, electrical stimulation, hot and cold packs, therapeutic exercise programs, activities of daily living training, all the things a physical therapist does under the direction and supervision of a physical therapist. The limit is that physical therapist assistants are considered technicians, so we don't perform evaluations, reevaluations, and discharge planning. But we certainly participate in that with the physical therapist that is in charge of the patient.
Nancy, how does your program prepare students for the field of MLT?
We have a lot of instrumentation right now in our laboratory, and it's not play, it's real instruments that you will find in hospitals and clinical sites. And our students are taught on these instruments here at HCC how to fix them, how to run them. So we prepare them with skill levels to pipette, to use a microscope. In addition to that, they get extensive lectures. We are preparing them to be able to be marketable once they leave HCC. And we're preparing them also that once they graduate, they can take the certification exam. It's a national exam. In 1 year, they can become an MLT because they will get all those skills that they need to do so.
And do your students, after they get that 1 year, do they have to go through continuing education to retain accreditation?
Absolutely, absolutely. And it really is dependent on where they work. Here in Maryland, we ask that they at least get 15 to 30 credit units every 3 years in order to maintain their certification.
Okay, very good. And Ken, about the physical therapist assistant program, how do you prepare students for your field?
Our program is designed with both the didactic, the anatomy, functional anatomy, talking about different systems such as orthopedic issues, neurologic issues. We have a clinical education program that is about 632 hours where the students will go out to clinics, and we have actually 4 clinical rotations that are integrated into our program. We have a lab that has an extensive amount of modality equipment, therapeutic exercise equipment. Right now the students are doing Foundations 1, where we're actually learning about involving the patients in range of motion activities, transfers, gait, things like that, and then in the fall we'll start getting more into systems. So the program is really designed to prepare generalists who are capable of finding jobs in all areas that are available in the physical therapy field.
And you said did I hear you right, 632 hours? That seems like a lot of hours.
Yes. The accreditation body, CAPTI, states that programs have to have between 540 and 720 hours. So the way we've incorporated it, the students will be going out to clinics for one-day observations in the fall. They will do 3-week full-time in January, and then we have 2 terminal affiliations that are 5 weeks each this coming summer 2014.
So if someone's looking for something hands-on in the health field, it's perfect.
Oh, physical therapy is pretty much all head and hands.
Head and hands. That's a good way to put it. Nancy, is there advanced educational opportunities available for the MLTs?
Oh, absolutely. Our students also go through clinical sites just like Ken's students do. And once they get out there, they can determine if they want to specialize. Our students are able to go from the Associate of Applied Science degree that they get here to a bachelor's degree, a master's, even a doctorate. And the sky's the limit. What do they want to do once they graduate from here? And they can make that decision after having been around all those different clinical sites as to what they want to specialize in. Our students tend to specialize in a particular science such as hematology, blood banking. They can become patient advocates. They can become researchers. It is up to them how they want to use their skills. So yes, the advancement that you can get through, you decide.
And they can get a good base here too, and then figure out which direction they want to go in, or maybe go in one area and then switch over to another. They need the foundation. That's what they can get here at HCC.
They do. And we have made this program so intense to allow them to investigate all these opportunities. Even during the first course, I have them using the computer and the websites. Information literacy is very, very important to us, to investigate all the opportunities. They investigate other universities. They investigate different sites that they can work at. It's part of the program itself.
That's wonderful. And Ken, tell us about the physical therapy assistant. Is that a terminal program, and what does that mean exactly?
Yeah. Again, physical therapists are considered technically trained, and the AAS degree that they receive here would allow them to sit for licensure and obtain a position. There's no transitional program that I'm aware of, except possibly one in Ohio, where someone who is a physical therapist assistant would then go on into a doctoral program. So if a physical therapist assistant was interested in doing something such as managing or owning their own clinics and things like that, they would pursue degrees in other areas like an MBA or healthcare management or something like that. But when they graduate, they are prepared to work in the field.
And I would imagine with the aging population and young people in our area that are athletes and get injured, I've seen it firsthand. Physical therapy offices are packed with people, so there's many opportunities.
Yes, the job market is looking very well through 2020. I'm not sure what's supposed to happen. I guess people like me will retire, so make room for the new people. So, but yeah, it's looking very good.
Okay,
us,
great.
yeah.
Well, that's wonderful. So, Ken, just to follow up, if someone wants to find out more information about the PTA program, what should they do?
They can certainly contact me. My phone number is 443-518-3042. Or kcravelli@howardcc.edu. Also, we have a nursing and allied health admissions and advising, and they're wonderful. They've worked with us, and Mary O'Rourke and her team are just wonderful. They could contact them as well.
Okay, great. And Nancy, how about for your program, MLT?
Well, certainly, I hope they contact me at 443-518-3048 and Calder at howardcc.edu. And I agree with Ken, the admission and advising office here, those people are really looking out for our students, and we're very pleased with what they're doing to help us help them.
All right. Well, thank you both for taking the time to be here today. Appreciate it, and I know our listening audience does as well.
Right, thank you.
Thank you.
Well, that wraps up this edition of In Focus. Please go to our website and check out all of the opportunities for careers in allied health. Thank you for watching, and I'll see you next time.